Hey, what's up, everyone? Let me turn this around real quick. Ooh, can I turn it around? Yes, I can. Hi, what is up, everyone? Hopefully, I'll get some folks to join me in on this live stream. If not, that's all right. Okay. Y'all can actually watch the recording of this. Hey, first of all, I just want to tell you to welcome to my YouTube channel. As always, my live streams are usually unannounced, so I really don't expect a lot of folks. But when I get people to join in, I am so elated. Look, if you have not yet subscribed to my channel, please go ahead and smash that subscribe button. Kick the like button on this video and all of my other videos. This is what helps my channel become more recognizable here in YouTube and also in Google. And if you have not yet rang that notification bell, you might want to do so you can be notified whenever I upload new content. So guys, this video is more for instructors, but if you are students or candidates, thank you. I already got a like. Yes, that's what I'm talking about. If you are students, you can, or candidates, you can go ahead and view this too, but this video is going to be more beneficial for instructors, okay, especially in the state of Texas, now that our authorized administrator is Prometric, okay? So I know we all have a lot of questions. I have a lot of questions. Hi, Gabriel. Gabriel. Hi, how are you doing? I have a lot of questions. I'm still doing a lot of research. I only have maybe like one or two Prometric instructors in my network, and I'm trying to get information out of both of them, right? Until I can get information that meshes together. But what information I do obtain, I am definitely going to share with you all. As you may have noticed, I've already started uploading some Prometric training videos. All right. Tara, hi from El Paso. I was stationed in El Paso for about a year and a half at William Beaumont. Yes, when I was in the Army. Um, but we all have questions, and we're all learning together. And that's what I told my students. We're going to be learning a lot of these skills together at the same time, right? So I just want to tell you all, especially instructors, don't panic. All right, don't panic. I'm trying to get these videos created and edited and uploaded as quickly as possible. I know it seems really slow, but guys, I'm like extremely busy. Really, I am extremely busy. And then again, I'm learning, right? Because I don't want to put out crappy videos for you all, right? I want to put out videos that will actually help you to learn and that are correct, right? So what I wanted to share with you all today is how to set up your classroom, right? In correlation with the Prometric testing. Now, I've been getting a lot of different information, but one piece of information that is consistent is how the bedside is set up, okay, with the supplies, all right? And so I'm just going to turn the camera around now just to show you how I have set up my bedside. I'm going to lower this down a little bit. Sorry about the moving around. Whoops. Let me lock this stand here. There we go. All right. So this is how I have my bedside supplies set up, because the Prometric room is going to be set up like an actual residence room, okay? And the supplies are either going to be on a linen cart or, I don't have a linen cart, so I'm actually using a small bookcase to place my linen next to the bedside. And then there are going to be some supplies kept in the bedside nightstand, okay? So just to show you how I have it set up, I'm gonna be carrying this camera, so I'm sorry if it gets a little wiggly. I have my gloves set up on top, and then I have some cups. I have some alcohol wipes or prep pads back there, and then I have my spoon, the feeding or meal tray, and some plates. And then on the second shelf, I have the lotion, a couple of bottles of lotion, couple of bottles of soap. I have the gate belt. I have the clothing protector and just one linen protector. I have to order some more, right? But it's really good to let your students know that if there are no chucks at the test site, that they can always use a large towel to substitute for the linen protector, okay? Hi, Jesus. How are you doing? Hi, David. How are you doing? All right. And then we have the graduate or measuring container. And then on the bottom shelf is where I have all of my linen. I have the towels, the washcloths, I have the privacy blanket. You can also, for the privacy blanket, because for some skills, Prometric does require you to place a privacy blanket over the person. So I actually just have a bedspread, right? So, but you can use a large bath towel or even a sheet, okay, in lieu of the privacy blanket. And then I have the hospital gowns, all right? And then I'm gonna walk over here. Again, sorry for the bumpiness of the camera because I'm actually holding it. Oops, sorry, I bumped it again. Over here, I have the dentures, okay, the residence dentures, usually going to be setting on the bedside nightstand. And I'm just going to move this remote. In the top drawer, I have it laid out to where I have some empty emesis basin. I have the toothpaste and denture paste in the back. I have the denture brushes. I have the toothettes or the swabs. And then I have toothbrushes here. And I just put these in the emesis basin just to keep everything organized, nice and neat. Okay, so that's what I have in the top drawer of the patient's nightstand. I'm gonna take that brush out because they're not gonna need a brush for testing. And then on the bottom, in the bottom drawer, and I'm gonna turn this and make it smaller. I'm sorry, guys. In the bottom, I have the bedpan on the top shelf, bottom drawer. I have the bedpan, toilet paper, and the wipes, and I just put everything in the bedpan, okay? And then I have some bath or wash basins in the bottom shelf, all right? And so this is basically how the test site is going to be set up. And like even when we tested under Pearson View, I made sure that, we had our own test site, which was really, really beneficial to us because I could actually set up my classroom to mimic how our test site is set up. So the kids would have a little bit of familiarity, when they got to our test site. But here we don't have no test site with Prometric, right? So, yeah. So, I'm just setting up to the best of my ability from the information that I'm receiving from Prometric instructors. Okay, not Prometric proctors, but Prometric instructors, because I figure, hey, they would know best, right? They've been testing under Prometric for quite some time. And so, usually everything stays the same from one state to the next, right? And that's what it's looking like with Prometric. But for instructors, guys, look, I have different supply areas, right? Different supply areas. I got to find a place to place my pillows close by, but different supply areas for testing, or for not for testing, I'm sorry, but for training. When you're actually training your students, you want to have a separate supply table that has only the supplies that they are going to need for testing. And even if the test site has extra, supply items on there, you want only the supplies that they are going to need for testing. This way, they will be able to become more familiar with the supply. So if they see anything extra, like a blood pressure cuff or a stethoscope, they're going to know, hey, we don't need those, right? I remember the supplies that we had during our mock testing. Sorry, guys, during our mock testing at class, and none of these supplies were there. Okay, and so that's why I like to. I'm gonna flip this camera back around. That's why I like to train my students with using only the supplies that they are going to be using during testing. Yes, okay. So I'm just gonna briefly show you all again, all right, how I have it set up. Again, if you have a linen cart, you can, fine, use your linen cart to set up your supplies. I don't have one, so I'm using a small bookshelf. Again, I have my gloves, some cups, spoons, alcohol wipes, the meal tray and plates on the top. And then on the second shelf, I have the lotion, the soap, the gate belt, the clothing protector, the linen protector, and the measuring container. And then on the bottom shelf, I have my linen. I have the towels, the washcloths, the privacy blanket, and the hospital gowns. And then over here, on the bedside stand, I have the dentures on top, okay, in the first drawer. And I only use these emesis basin for organization, okay? If you have something else that you can place, the toothbrushes in, that's fine, but I'm using what I got, right? So I have the toothbrushes, the toothets or the swabs, the denture brushes, and then some empty basins, right? So when the students come to collect, they'll just collect a basin and the denture brush and toothbrush and toothet, right? Everything's lined up for them. And then I have the toothpaste and the denture paste here in the back. Don't mind the brush. I'm gonna get rid of the brush. And then on the bottom, I have the bedpan with the toilet paper and wipes. And on the bottom shelf, I have a few of the bath or wash basins, okay? Um, so guys, I hope this was, oh, sorry. Let me just set this down because I keep bumping it into stuff. And I'm gonna turn it around this way so y'all can see the shelf again, okay? But hopefully this live stream is helpful for you all. I'm gonna move out the way because I know I'm gonna get somebody saying you were standing in front of your supply stand and we couldn't see anything, right? So I'm off to the side, okay? But yeah, so I know that this is a very uncertain time for all of us, instructors, students, and candidates alike here in Texas. This is something new to us, but don't panic. We just have to learn something new every day, okay, and which I'm trying to do. But if we work together, yes, if we work together, we can do great things, right, for our students. So this is just the way I have it set up. Yeah, and let me see, I'm trying to think if I have anything else to say to you all. Just with the videos, guys, please bear with me, okay? I know I had one subscriber say, we need all the Prometric videos, and I know we do, and I am trying, trust me, but it's just a lot. It's a lot, putting these videos together. It takes a lot of time, takes a lot of energy, and a lot of time right now I don't have. I try to, squeeze doing one video in, one week, and then trying to squeeze another video in another week. And sometimes it just doesn't work out like that, right? But I am going to try to do everything. I'm going to be updating the Prometric grid sheets that I created. There are a couple of modifications that I want to make. I know one is with the bedpan, one is with ambulation, another one is with feeding, because with ambulation, the patient or resident is actually going to be sitting in a chair during testing. With feeding, the person or resident is going to be sitting in a chair already, right? So just little minor modifications that I'm gonna do with the grid sheets. Once I get those grid sheets modified, updated, I'm going to put them on my Etsy storefront, and they are going to be free for 1 week. Okay, free for 1 week for anyone who wants to download them and use them in your classroom, or if you're a candidate and you want to download them just to review the steps. Now, how I have the steps are going to be in the most logical order. I know that Prometric has a skills checklist with all 22 skills. However, as you're reading through the skills, if you have done so already, I'm sure you've probably noticed that none of the indirect care skills are integrated into the those steps in the Prometric skills checklist. The indirect care skills of infection control, safety, privacy, dignity, and communication. None of those are integrated into those steps, right? With Pearson VUE, they were for the most part. But with Prometric, they are not, because they're like, hey, you've gotten this far in the training, you're testing, you should know when to address and how to address the resident. You should know when and how to introduce yourself. You should know when to provide privacy, right? You should know when to don and doff gloves and when to wash your hands. And that's true. I mean, it's true, right? If your students are at the end of the training program and they are ready to test, they should already know when to do all of this, right? They should. Yeah, guys. So I think I'm gonna try to work on one skill today. I'm gonna either do dressing or partial bed bath. You see, they have different names for these, right? Different skills. Dressing and dressing is actually done, with Pearson VUE. It was done on a live person, and all we had to do was put on a shirt, right? We didn't even have to button the shirt up. But for Prometric, we have to put on shirt, we have to put on pants, and we have to put on socks. Yes. So it's a lot of differences with Prometric. With partial bed bath, Pearson VUE, it was modified bed bath. It was done on a live person. But under Prometric, we're actually doing a partial bed bath, just the trunk, the face, the trunk, one arm, hand, and underarm. Okay, just partial. And it is, and plus it's a back rub too. In the back, I forgot, you got to wash the back too. So it's the face, the entire trunk, one arm, hand, and underarm in the back. And then you also have to give a back rub or a back massage. Yeah, you sure do, right? And that skill, the partial bed bath and back rub, is actually performed on a mannequin. Hi, Sabrina. Hi, how are you doing? Hey, everyone. Yeah, so that's actually performed on a mannequin. Yeah, a lot of changes. And like I said, we're going to be learning this together. Yes, indeed. And I guess that's it. So I'm going to let you all go. I hope this live stream was informational and beneficial to you all, especially if you are instructors. Oh, thank you, Gabriel. Thank you so much. I love what I do. So it doesn't even feel like work, right? It doesn't even feel like work. Hi, Tier. Oh, thank you. You too. You too. Thank you so much for sharing my videos and referring my videos to your classmates. I truly appreciate that. Hey, tell your classmates to smash that subscribe button too, okay? Don't just watch my videos, smash that subscribe button, okay? So I'm gonna get ready to go. I'm gonna get ready to let you all go so I can practice one of these skills and get a video done real quick before I have a couple of students coming in for blended learning at 3. So I'm going to try to get the video completed before then. Yes. So turn on your I can't even talk. Turn on your notification bell, right? No, turn on your notification bell so you'll be notified whenever I upload new content. especially with Prometric. Okay, if you're now testing on the Prometric, and if you are an instructor here in the state of Texas, ring that notification bell, okay? Kick the like button again on this video and all of my other videos. That will help my channel become more recognizable here in YouTube and also in Google. And then, guys, if you have not subscribed, come on now, smash that subscribe button, okay? Especially if you're watching my videos and my videos are helpful and you know they're helping you out. Go ahead and smash that subscribe button. I'm gonna go now, guys. Okay, I will see you all later. Mwah. Again, I love you all. Thank you so much for your continued support. I'm still getting a lot of condolences sent in to me, you know, regarding the unexpected passing away of my husband. I really, really appreciate those condolences and continued prayers. I truly do. Okay, going through a hard time, but I'm still working hard to get y'all what you all need. All right, love you guys. Ciao.